Welcome back to Taking Charge of My Cancer, episode 77. I have the pleasure to have with me not just one of my PT colleagues, but one of my greater friends, is Sruti Manvi. Sruti graduated with a bachelor's degree in physical therapy from Kasturba Medical College in Manipal, India in 1997. She completed her post-professional master's in physical therapy from Loma School at ILS Health in 2000 and her manual therapy certification and doctorate in physical therapy from the University of San Augustine. She has been practicing for 26 years in her areas of interest include orthopedic manual therapy, oncology rehabilitation, and craniofacial pain and cervicogenic headaches, as well management of TMJ. She is a double board certified specialist in oncology physical therapy and orthopedic physical therapy. She's as well a certified lymphedema therapist. She works as a senior physical therapist at Baylor Institute for Rehabilitation in Plano, Texas. She has also served as the revital coordinator for the clinic, and as the revital coordinator, she helped with creating pre-rehabilitation pathways for breast, lung, head and neck cancers in collaboration with Texas Oncology and Revital Cancer Rehabilitation. She has taught AC courses and workshops in evaluation and management of head and neck lymphedema, and she has been a core faculty member and a lead content developer for Select Medical Revital Cancer Rehabilitation. She also serves as one of the primary mentors for the Baylor and Scott Y Oncology residency. She's married and has two beautiful girls. She lives in Frisco, Texas, loves to read, listen to music, and being a mom. So, Ruth, it's a pleasure to have you with me today.
Thank you, Thurley. Thank you for that warm introduction. She's right. She's absolutely right. She and I were colleagues in Florida. And believe it or not, I got into being a manual therapist thanks to Thurley Munoz. Um, and we are great friends. And it is amazing how our pathways kind of meet because we got into cancer rehabilitation pretty much around the same time,
Yep.
and have passion for pretty much treating the same kind of patients. And so it's beautiful to see how our careers are very parallel, and we learn from each other, right? It's amazing.
Yes, yes. So we go back together. Man, we were just talking about that. What, 22 years ago or something like that?
No, not that long ago. It'll will sound both sound so old. I met you in 2001.
Yeah. And
So
that's
yeah,
when we met. Yeah, yeah.
yeah.
Has been a while.
Uh,
Uh,
but yeah, it's when I was hired at Baptist as a young therapist, and you'd been there for a while, and you took me under your wings, and um, got me on the journey of getting my manual therapy certification, and getting into craniofacial pain and things like that. And then, of course, I moved to Dallas about 12 years ago. So we haven't seen each other since then. But yeah, it's been a while.
it's been a while. But so tell me about a little bit about your role, and were you always planning doing this? Like, how do you end up in oncology?
Yeah, so that's a very interesting story, actually, to be honest with you. So it was a few years ago. I was still at in Florida treating at Baptist Medical Center. And my first encounter was a breast cancer survivor who'd been sent to me for left arm pain. And being the orthopedic manual therapist, I thought it was cervicogenic radiculopathy, right? It was not. So that kind of triggered a sense of, oh my God, I don't know anything about oncology or what to do with oncology survivors. And also the realization that how underserved this population is, right? These patients don't know where to go. They don't know they don't know what to do for themselves in terms of pain, in terms of fatigue, in terms of every side effect that they might have from their treatments. And so that started my journey long time ago, and during that time, and I realized that we didn't have actually a proper program for cancer rehabilitation. There were very few courses that you could take across the nation. So I signed up for those, because as much as we know about the musculoskeletal system, the nervous system, and all of that, we as therapists didn't know very much about the physiology of cancer as a disease process, the treatments that these patients receive, and then, most importantly, the key adverse clinical effects those treatments can have on these patients that can bring about functional mobility issues, just side effects and impairments that kind of impact them on a day to day basis. So that is what interested me the most. So that journey then led to taking a lot more courses. I went and got certified as a lymphedema therapist as well, because I realized that is one of the impairments that can be brought about in patients who have undergone surgery and radiation. And then when I moved to Dallas, I was fortunate enough to find like-minded people who were extremely passionate about, serving this population. And so that's how the program grew. And now I pretty much see 98% of my caseload is all cancer rehab. And the one key thing that I have learned is that, a few years ago, there weren't many of us out there. But what I find fascinating now is that through APTA and the education that's being provided nationwide, and the fact that we have more certified oncology rehab specialists in the nation, I feel like this movement that started a few years ago is taking, charge of letting these patients know that there are therapists who can treat them for things that they are having issues with. That's pretty much how my journey started, and I can't tell you how gratifying and satisfying it is to treat this patient population, especially because one of my patient actually said to me, and it's a quote that I love. She said, "Medicine adds days to life, but cancer rehabilitation adds life to days."
Oh my God, I'm gonna take on that quote. That's so cool. That's so inspiring.
So I feel that that quote is not only very powerful, but it is extremely true. And the fact that cancer rehabilitation specialists are now working very closely with oncologists with medical oncologists, surgical oncologists, radiation oncologists, and really stepping forward to taking charge of being part of their cancer care, I think that is extremely powerful for the not just being part of the advocacy of cancer care, but also as a profession. I think we are, doing a great service to these patients.
Absolutely. And I'm with you, right? We come from a background to being orthopedic manual therapists, and then we go into the cancer care, which is pretty much manual therapy as well. It's the same joints, the same issues, but you just add the flavor, like I always tell my students, of the cancer to it, and the treatments that is involved. But yes, you absolutely right. I think it's such a rewarding condition. I mean, not rewarding condition, but it is, these patients really are so grateful. I think sometimes we're like a light in their middle of their secondary effects of their cancer treatment. So they're actually looking forward to come and see us because they know we make them feel better, right? In the middle of all this. And it's so great to just wake up in the morning and don't think once to just be here and just help them out every day. So it's just really, I don't know if I can ever go back to do a full-time orthopedics ever.
I
Right.
don't think either. I don't think I will be allowed, number one. Number two, um, I mean, not that that didn't bring me satisfaction, it did, but I think the element of being there for your patient through not just before their cancer treatment starts, because prehabilitation is as important as post-hab, but also during their cancer treatment and much beyond. And to know that you're going to be part of that journey, with the ups and lows that these patients undergo, that you don't find in an orthopedic world, right? I mean, you get them done. I mean, they get done, they move on, and they probably will never see you again. But these patients will stay with you, especially with this concept of prospective surveillance that we have now in cancer rehabilitation, where we know that we have to be with the patient, not through their journey, but beyond as well. Understanding that there are these latent effects of, treatment that they undergo. So just being there as part of their journey and much beyond, I think, is extremely unique to cancer rehabilitation. I don't think any other aspect of rehabilitation does that to such a larger extent anyway. So yeah, I think this is it, Durley, we are stuck. I mean, this
Stuck.
gives
And
us
I
so much
love to
joy.
be stuck. Yeah. And I don't mind at all to be stuck in this field. Okay.
Exactly.
What good resources would you advise patients to look into to educate themselves?
So there are a lot of resources out there, right? I mean, you have the cancernet.com, you have American Cancer Society does a really good job in providing some basic understanding of their cancer disease, the treatments that might come their way. There is the Cancer Care Helping Hand, which has a lot of resources as well. Then there's the Cancer Research Institute, and then of course National Cancer Institute itself, which is both for providers and clinicians, gives a really good understanding of the disease process, the treatments that are available, what should you expect out of that. And then I think American Cancer Society also does a really good job in kind of giving you out information on support groups. But I think the best thing a patient can do is find local support groups wherever they are at, and that information is actually available. Should be available at with the nurse navigators that are taking care of them in terms of navigating care for these patients from the time they are diagnosed and through their journey. Um, and then really forming part of those cancer support groups, really. And there's a lot of information on Facebook as well, like local support groups put out a lot of information on Facebook. Then of course these are these huge non
Profit.
profit organizations out there for breast cancer, for head and neck cancer, and things like that. So I would uh, ask my patient to either to go to American Cancer Societies or Cancer Net or Cancer Care Helping Hands or National Cancer Institute, and then of course finding information at their local oncologist's office, because a lot of times those nurse navigators will give them the information that they need. Because these resources, I mean, and the fact that they're coming to us, I mean, there are a lot of local resources that we know, right, Durley, that we can obviously give that information to these patients about finding resources. And most importantly, I think one of the biggest resources that I give out to these patients is a list of psychologists that are equipped to see oncology patients. I think that is extremely, extremely important,
Yeah,
because
absolutely.
not only these patients undergo a lot of physical changes, but that's the cancer diagnosis itself has such a impact on their mental health as well, right? I mean, it really changes your life. And so these patients go through a lot of depression, a lot of anxiety, a lot of stress about how do we return to work, a lot of things socioeconomically, how are they going to like sustain
Yep.
uh, livelihood while going through cancer treatment. So things of that nature. I think there are a lot of external resources that these patients should be looking out for. Uh, so for me, the number three resources that I would actually give information to these patients on is number one, psychologists that specially treat oncology patients. Number two, nutritionists and dietitians that are taking care of these patients, especially for your head and neck cancer population, or your patients with any kind of GI issues that will lose weight and they don't know how to like sustain the nutrition. And then the third one is exercise community groups out there that can keep up these patients with exercises and things like that, which are safely done, especially for the oncology population. That's what I'm most worried about, is if these patients go see personal trainers who are not really trained to see cancer patients. That's what kind of scares me a little bit. So I
Mhm.
give them resources on community centers that are equipped to see patients for exercise. So we have a local exercise group that's called Courage. There's also those Live Strong programs through the YMCA, people who know what to do and how to do with the cancer patient survivors after their treatment is done. Because once they are discharged and during that time before prospective surveillance hits and they come back to see us, they still need those resources. So I think these are some like basic resources that I would definitely give out to my patients, especially counseling, nutrition, and then exercise.
Exactly. And all those, you're right on the dot, and I'm totally back that up. I think is so important. And I think we actually have something else that can be very beneficial as well for you guys to think about it if you have an occupational therapy. So we have the fortune to have an occupational therapist who his strength is mental health. So
Mm-hmm.
we've been actually bringing him to see our breast cancer patients pre-op, and has
Mm.
been really successful. Like, has been really a great help. And every patient really feel like that has been like, it's nice to see here. I'm here to support you. I'm not a psychologist, but certainly I can give you a lot of tools to manage that anxiety, and we can just chat, and then he just see them after working whatever their needs are. But that's a nice tool that we now have, and has been very valuable. That I did not think about that. But again, this is an area that not that many occupational therapists are gonna, know about it. But that's kind of like something that is pretty neat. So if anybody in your program has an occupational therapist who has some interest in that mental health, and not only that, but all these, chemo brain and all these things from chemo,
So
that's
when you say resources, I can think of internal resources and of obviously external
that's
resources, right? So fortunately for me, I work at a multidisciplinary clinic. Not many of them have that great fortune out there, but we typically, when we look at for example, say a breast cancer survivor, right? And I'm looking at them, and they have CIPN, and they have cognitive dysfunction, which is chemo related. They have issues with pelvic floor because they're on hormone therapy. I'm looking at internal resources as well, because the buck doesn't stop at you. The buck needs to be treating these patients holistically. So I'm looking at internal resources. Um, and that's what you should be doing. I mean, if you're not a lymphedema therapist and your patient is presenting with signs and symptoms of lymphedema, you should be looking for a lymphedema therapist.
yes, absolutely.
If the patient has a chemo brain, then you should be looking at either a speech language pathologist or an occupational therapist who is equipped to see these patients for evaluation and then obviously as treatment. If you have a patient who is on a hormone therapy, you should be having those discussions about pelvic floor weakness or incontinence or you know issues with intercourse. I mean, these questions are not typically asked by the oncologist. I can tell you that much. So
Uh-huh.
we, as their rehabilitation specialists, should be asking those questions. And if the answer is yes to any of those, then you should be backing that up with somebody who is equipped to see that, and that's the
Absolutely.
pelvic abdominal therapist. So I think in terms of resources, we need to be looking at both internal resources and external resources.
Yep, yep.
And we haven't had any OT who's trained to see for mental health. So typically we do have a group of psychologists and neuropsychologists who work very closely with us. And so typically when you're talking to these patients, and any perception I get of them, even the slightest inkling I get that these patients are needing those services, uh, we definitely refer them to these patients outside of our clinic.
Okay, perfect. And the next question was gonna be, can you give 3 valuable tips for patients with cancer? And I think you've already been giving them a lot of valuable tips, just talking
So
about.
one thing I actually would tell these patients is be your own advocate.
Mhm.
Knowledge is power. So the more you know, the more you can ask for. So, find out where, where your nearest cancer rehab clinic is. If your oncologist has not already referred you to those clinics, then you should be asking for those services, because a lot of times, the one question that I get from a lot of patients that have come to see me is, why was I not told that this existed? Um, and it's because the number one thing on your oncologist's mind is to ensure that you're alive,
Yep.
right? That they beat the cancer first.
Mhm.
So all of the elements that come after beating the cancer or while you're beating cancer is not on their mind.
Mhm.
And so when I think these podcasts and the more podcasts that are out there, the one thing I would advocate is patient advocacy, because it's extremely important for that patient to ask for these services if they don't automatically are a referral. There
Yep.
are not many programs like ours thoroughly out there that automatically get referrals, and cancer rehabilitation has become the standard of care.
Mhm.
There are not many programs that exist like ours. And I think having this word out that we actually as a community exist, and
Mhm.
this is what we do for a living, is to take care of patients not just during but much beyond, is something that I would like my patients to know
Okay.
for sure.
Yes, that's great. And I'm glad you mentioned that. And I always, even with the patients, when they come in and they have all this information that is so overwhelming and they're really anxious about it, I always encourage them, if you don't feel good with that information, get for a second opinion. Go
Hmm.
see somebody else. Don't even feel bad to say to a physician, no, I don't want to do that.
Hmm.
But then have the right reasons why, right?
Yeah.
You put
Right.
everything on the table and know what the good evidence show you, no Dr. Google, but good evidence from the places that you just mentioned before, and just get second opinions, right? You don't have to take everything, and you just can say, no, I don't want that. I want this. If you cannot give me that, where can I go get it? Or you go find it somewhere that
Yeah.
can for where you want. So it's super important. And with that, it's super important for their family support or friend support, right? Because you get a diagnosis of cancer, the only thing you're thinking is you're just gonna die, right? And
Hmm.
and everything else just is just, oh my God, who's gonna take care of my kids or my significant other or my parents or whatever it is. And then everything that goes after that is just travel through your brain because it's just too much. So having that significant other or somebody close, or if you know of someone who is a healthcare provider who understands a little bit more, that will be a great idea to bring them to these appointments. Here our docs always have like Zoom calls with other relatives if they cannot be on the appointments, or on the phone they're listening to the whole thing so they can ask questions during the time of the appointment. So it's all these different things that can be beneficial for everyone. Great.
Absolutely.
What does it mean to advocate for yourself, and how can people do that? And we just pretty much kind of talk about that, right? So
Yeah.
it's like this is how important. And again, you're the owner of your body. So at the end of the day, is your decision what you
Yeah.
want to do with it. And then hopefully, it's some patients who don't need to have a double mastectomy and they don't need to have breast reconstruction from a DIP, right? And they just kind of like, well, if I'm gonna be looking good, then why not? But you don't really medically need that. So that's different ball game. But
Yeah.
if it's something that you need to do to save your life, then it's something that you need to really look into that and decide with good help. So
Yeah.
I'm gonna go into the next one. What is the common questions that you find oncology patients ask you, and will you share that?
Why did nobody tell me that cancer rehab existed? Like I told you, right? That is the most common question I get. And the reason being is that uh, I tell my patients this many, 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 many decades ago, when you had orthopedic surgeries done, um, I don't think orthopedics MDs realized that there actually needs to be somebody who can take care of my patients after surgery, right? I think we are in that kind of a mode right now where we actually have to educate our oncology providers that we actually exist. And I think we're doing a really good job from where we were a few years ago.
Yeah.
I mean, we have done I mean, American Physical Therapy Association in itself, and our local hospitals, and local networking that we do. I think we have done a really, really good job in being able to say, "Hey, we exist, and we're here to help you out." One thing that I would suggest that patients do is, find therapists by Googling, or on American Physical Therapy Association. When you say choose PT, you can actually get a guide of all the therapists that have been certified in oncology in your market. That way, you're going to somebody who has actually taken the time to get, um, educated about oncology and its treatment, and is also equipped to see you. The other question that I get a lot is, will I ever get back to doing what I was able to do before? Um, and then that is a very loaded question, obviously, right? Because you can't really predict prognosis, number one, but you can predict what you can do for the patient in the moment of time. You can't predict the future, obviously, but you can be there to support them in the moment. And that's what I tell my patients, that you can take one day at a time, and that day needs to be, we need to do the best we can with the day that's provided to you, right? So and also in the moment of where you are in terms of seeking your treatment, right? If somebody comes in to see me right after surgery, their biggest challenge is, am I ever going to be able to put my hair up? Or
Yep.
am I, dressing and things like that? Will I be able to get ready for radiation? If somebody is at the point where they have radiation, getting radiation, what am I doing with skin changes? What am I doing with all this fatigue that I didn't have before? So I tell my patients every treatment is going to bring about tribulations of its own. But the most important thing that you have to remember is that there is a community that is supporting you.
Mhm.
Your nurse navigator, your oncologists, your nurses, your psychologists, and me. It's a village. And
Really
you're
nice.
part of that village, right? And so we are just here to support you in any which way you want us to
Yeah.
support you. And that is the key message that I want to give patients, is that sometimes it's not just, we are physical therapists. Yeah, we are definitely obsessed with movement and function and things like that. But I think for a cancer rehabilitation specialist, I think it goes above and beyond that,
Oh yeah.
is that we are there for that patient spiritually, emotionally, physically, mentally, and
Yeah.
holistically.
Yeah.
So I think that is the most important thing I would tell any cancer patient and survivor out there, is that seek a cancer rehabilitation specialist, because this is what we are equipped to do,
Yep.
is provide you that holistic care.
Yep. Any book recommendations that you have for the audience and why?
So there are two books that I really loved. The first one is The Emperor of All Maladies. I don't know if you've read it. It's by Siddhartha Mukherjee. And he actually, in an interview that I saw, said, he wrote that book really in the response to a demand of a patient who said, um, I'm willing to go on fighting, but I need to know what it is that I'm battling. And it is so important, right? I mean, they have that spirit of wanting to fight it, but
Yep.
they also don't know what is it that they are battling. And
Yep.
I think that is where that communication gap,
Mhm.
we sometimes do fill.
Mhm.
Is that the gap that is created with, yes, I have this diagnosis, but I don't know very much about what it is that I'm going to be battling in the coming days. And I think that that's what we do a good job with. The second book that really teared me up like crazy was When Breath Becomes Air.
Oh wow. Mhm.
Yeah. And it's a memoir by actually a physician himself, who was battling stage 4 metastatic lung cancer.
Okay.
Two very powerful books that I think the world of oncology, cancer rehab specialists, and also maybe patients will love to read. So those are two book recommendations that I would definitely make. Those are
Great.
two books I read, so that I definitely can recommend those to you.
Great. How about podcast?
um, so CDC cancer podcasts do a really good job. Control, what is the Center for Control of Disease Prevention, and that's the podcast, and it has a special cancer podcast. They do a good job. Then there is a podcast that's out there, which is the American Cancer Society puts out. I mean, it has some information, but in terms of podcasts, I mean, TED Talks and podcasts, you can Google, and it'll all depend on what is it that you're trying to find. Uh, there are a lot of good podcasts for caregivers as well,
Mhm.
because we all talk about just cancer patients, but we also have to think about the family that's supporting these patients, and the caregiver fatigue that can be caused in the caregiver population as well, right? I mean, they are the people who are getting these people to appointments,
Yep.
going through the ups and lows of treatments and the side effects. So there are a lot of podcasts there in terms of caregiver support. And then, unfortunately, sometimes, your cancer journey can sometimes abruptly come to an end. I mean, that we've seen happen. So there are a lot of podcasts out there on grieving mechanisms, and how do you grieve for somebody's loss. And I think that's important for us as well, elderly,
Yeah.
because in the interim of you treating these patients, you do get attached to these patients.
Oh yeah.
I have had a few patients that I have lost, and you do realize that it takes a toll on you.
Mhm.
It does. You do get attached to these patients to a point where their family is also involved, and so um, when they reach out to you and say, this patient is no more, it definitely really breaks your heart sometimes, right? I mean, because you've been there for them. So I think
Absolutely.
there are podcasts out there that I have also listened to, um, that gives you the sense of like, how do you cope with loss? And I think that's important for us as
Very good
practitioners
point.
as well,
Yes,
because it equips you to be able to, you know, grieve, but in the sense that also teach you how to celebrate somebody's life.
yeah, yeah, that's a very good point. That's very good. How can people find you?
Google me.
I have a lot of free info in the show notes as well.
No, but generally, how I tell people to find therapists who are oncology specialists is to be able to go to Google and do choose PT through the APTA page. American Physical Therapy Association has done a really good job in, you know, giving. Of course, you have to sign up to be able to show up on the Google search, obviously. But if you are part of that network, then all you need to do is put in my name in that choose PT, sign up, and then I will show up. But I basically currently work at Baylor Scott and White Institute for Rehabilitation in the Dallas area. My clinic is situated in the Plano area, and we are a multidisciplinary clinic. So we see a lot of patients, not just for oncology, but for all kinds of things. And so if you, all you need to know is, you just need a referral. If you don't have a referral, I can still see you for direct access, but you'll eventually have to get a referral.
Mhm.
But that's how you find me. And if you need somebody locally, you can still email me and I can find somebody local for you if you don't live close to where I uh, practice. But that's how you find me.
Perfect. Is anything else would you like to share before I let you go?
The one thing I will like to say is that, Baylor Scott and White Institute for Rehabilitation, and I know I'm just saying it out loud, is has a fantastic oncology residency program. And the reason why I feel like somebody really gets a lot out of these residency programs is because you have a lot of experienced clinicians who are mentoring you, number one. Number two, you get a lot of updates on literature reviews and things like that, where you probably wouldn't get it out on your own. And number three, it really gives you the exposure to see how cancer rehabilitation is actually put into practice. So, if you have anybody who's interested in oncology rehabilitation residency program, do let them know that we have one and that we are actually taking applications right now. The other thing is, I also work for the Revital Cancer Rehabilitation, which is part of the Select Medical Corporation. And the whole idea is that the whole idea of this whole program is to ensure that we are propagating the idea is that cancer rehabilitation should be the standard of care and not just an afterthought. So
Yeah.
I'll leave you with that.
That's amazing. I again, I'm fighting, and this is one of the reasons that I'm doing this podcast, just for just more like you say, more knowledge, more power. So it's just for not just patients and caregivers, but healthcare providers, from the surgeons to anybody who is nutritionists, of course, rehabilitation practitioners, anything out there that is just adding a piece of this big puzzle of how do I deal with this condition that is not just one day and gone, but the rest of my life. So, but yes, absolutely. I'm kind of happy to know, even with the schools, right? Like it's now students asking to come and do an internship in a specific oncology, which is great. Before was like, I really don't know what that is. So again, I hope that the next step is for our PTA schools to actually increase the amount of knowledge that students needs to be given during PTA schooling regarding this condition. And I think that's gonna really is gonna be more powerful as they come into this internship, but they don't feel so lost and overwhelmed in the beginning because they really don't know that much at all from
Yeah.
school.
And
So
you remember the times when a lot of things we were taught were contraindicated in cancer patients,
oh
and now
yeah,
you just look at it and go, no, not really.
yeah, exactly, exactly, exactly. I remember doing some of my visceral mobilization courses, and Even when I was just doing dry needling not long ago, I was like, yeah, it's a contraindication. It's like, well, not really. And and it's like I do this day out, right? It's like, no, it's not. So, but yeah, so hopefully we can continue working. Glad that you're doing part of the resident, educating more, hopefully continue working on more evidence based so we can really educate physicians and surgeons about certain things that we do that is not necessarily how they thought can be a contraindication. So we can
Mhm.
talk here for a whole day, but I know you have to go, so do I. But that was amazing. I love this conversation. I miss you. So happy to be able to talk to you today.
I miss you too, Darly. Keep up the good work, girl.
Thank you. Have a great rest of the afternoon and a good weekend.
You too.
Bye.